Hello and welcome to the Pause It podcast. I'm Sam, and with me, Dr. Sam, and with me is Dr. Robert. How are you doing?
Good, Sam. How are you doing today?
You know, I'm doing great. We've had a good day. I was home today with the kiddos, so those are always really fun days. We find some adventure to do, and that's what we did today.
Yeah. How was that weather? Was it warm?
Oh my gosh, it's so warm, like oppressively warm. It is
Oh,
so hot outside right now. How about you guys? How is it? I mean, you're coastline, so maybe it's not so bad.
yeah. It's still a little toasty today. Like I felt bad for Loki. Like he'll just go sit on the porch and just like start panting like crazy, and he's starting to get that lar power sound a little bit, and I'm like, knock that off.
Oh.
So we'll
We'll do a
see.
podcast on that one of these days.
Yeah,
Actually, it's
we'll
a
do.
really interesting one to do, so we should definitely do that. And for those of you who don't know, that's laryngeal paralysis that he's
Yep,
talking about.
yep. And it's something that's not a lot of fun to deal with. But as dogs get older, they can sometimes get it. So
Is it
so
as
I'm watching.
common in huskies as it is in labs?
Not as common, but I've definitely seen it in a fair amount, a number of. I actually seen it congenital in huskies. Two of
Mm-hmm.
them, actually,
Really?
ironically enough.
Two of
Yeah,
them. That's terrible.
yeah, two different huskies.
Oh, wow.
So I don't know, but yeah, he's making some. His bark has changed, and he's
Got a little strider.
yeah, he sounds a little. I'm like, knock that off. Don't
You're
do
like,
it. I'm
don't
like,
do that.
we've been good. Don't mess it up. So we'll see.
That
But
is really
anyway,
interesting. Well, I hope that he does not get that. I have a lab, so I'm always like, but he's
exactly.
3. Actually, tomorrow is Gus's birthday,
Hey,
so
well, we should post a happy birthday post for him on
we're
social
going
media.
to. My girls already have it all planned. You don't even know. They're
Oh,
like, "Can we make a video?" And I was like, "Yeah, we can make a video."
well, if you want to do a kid less post for myBalto, you're welcome to do
That's
that too.
what I mean. They'll
Okay,
their voices will be in there, not their
good.
faces.
I like that. That sounds great. So,
So yeah, stay tuned for that. But today we're talking about pain management in dogs. I think it's an important topic. It's something that you and I both deal with every day. I mean, I can't think of a
mm,
day that goes by without it. And it's a vast, huge, pretty big topic. So I mean, we're touching on it today. I'm sure we'll probably talk about it again or at least aspects of it again. But I thought I had a case. A lot of these podcast ideas I feel like come from like cases that we have, right?
oh
So
yeah,
it's like usually something that happens like, let's talk about this. I saw this and it makes me think of it. But I had a case where a dog was really, really painful and the owner had given some aspirin at home before he brought his dog in. And I just remember thinking to myself, like, oh, I know why he did it. And I know that he was trying to be helpful. But man, that just limited my ability to do something that would be much more helpful. And so I thought, maybe this is a good education moment. Maybe we should do a podcast about pain management, the different types of pain management that we use, and like maybe why that scenario could have possibly been handled better. So, and like it was all well intended, but just
yeah.
unfortunate.
I think that's it's a really good one to bring up too, because a lot of phone calls that I get in the middle of the night about like even just like dosing frequencies for different medications that a primary veterinarian will prescribe, or why we won't prescribe things certain times.
Hmm.
And the problems with giving medications without talking to a veterinarian first, and how that can
Yeah.
affect what medication we'll give later. And that's probably my biggest issue I've seen. So I'm sure I'll touch on that somewhere in this
Well, yeah, I
podcast.
would imagine that must happen to you a lot because usually people are trying to like avoid coming to you and they do that by
Yeah.
trying something themselves at home.
It makes it so much worse. And I say just at least call first. That's all you gotta do, just call first. Because half the time an owner, and they have the best intentions, right? It's not like they're trying to do something worse, but a lot of times like they'll give an eye drop for their pet and they didn't realize their dog has an ulcer and you don't want to give that medication, or they'll give a steroid because their dog's been on steroids in the past, but then I can't send them home with an anti-inflammatory later because they can cause gastric ulcers. So it's a lot of like, just call. Calling's nice.
Yeah, I
So
totally agree. Do you think that there's a class of drug that you prescribe most often for pain, and if so, what kind of pain? What are you seeing that you're sending that home?
So I really like anti-inflammatories like carprofen. I don't work for them, just so we're clear. But
Well, carprofen's the drug name. So anyway.
exactly. Exactly. Yeah, thank you. Exactly. So corporate exactly. So I didn't say
Because
the right
there's
one. Thank you.
Truprofen and Rimadyl and
Exactly. So all the ones
Caprovet.
that there's so many now. Like
Yeah.
it's just crazy how often they are. But yeah, that's probably the one I like the most, just as long as they're a younger dog and I have to like check their kidney values right away because they can
Mhm.
affect them inversely if they're already elevated. But it's probably the one that I think is the most helpful because I honestly like when we are in pain or we have a headache, we usually use anti-inflammatories, and they do a great job. Honestly,
Oh
reducing.
yeah.
I think some people need to tie the connection to when you reduce inflammation, you're also reducing pain, and they're directly
Oh yeah.
correlated with each other. I think
Mhm.
some people, owners just don't sometimes get or understand that right away. But
Yeah.
that's a big part of it. Reduce inflammation, you will reduce the pain. That's a big
Yeah.
part of it. What
And I
about you?
think it is true that I would say, I mean, I use carprofen every single day
Mhm.
or another non-steroidal anti-inflammatory, which is what that is, or an NSAID. So when you said ibuprofen, that's the one that most people understand to be
Yeah.
an NSAID, right? And so, and I think it is hard sometimes when you're describing it to owners. Exactly what you said is true. I think a lot of times people are like, well, I need a pain medicine. I'm like, well, this is a pain medicine. It is an
Yeah.
anti-inflammatory pain medicine because so many of our conditions that we're treating are inflammatory. And
Mhm.
so that's where the pain comes from. Think about when you have a swollen ankle, a swollen joint, or, I mean,
Exactly.
I have a chronic inflammatory condition. That's what arthritis is,
Mhm.
it's painful. And so yeah, the number one class of drug that I think I probably send home the most is an NSAID. And then there's different ones. In our pets, the most important thing to know is like how specific they are. They are very, very specific because they're so much more likely to get a GI upset,
Yeah.
a GI ulcer, um, upset too, I guess, but also really the ulcerations that we worry about. And they're much more sensitive to it than we are. So that's why you can't give ibuprofen to a dog. Um, there are some human ones that you can, but you have to do so with caution, right? You have to do it
Yeah.
properly. And
They have
I
a
would
very narrow
say
dose range, which is the tough part.
exactly. And so you don't really want to tinker around with it because things like something like diclofenac, which is
Mhm.
for people, right? Like so most people have heard of Voltaren cream at this point in time, where you can rub it on your joints for arthritis. Well, yeah, you can give, there is oral diclofenac as well that you could give to a dog. But like you said, the safety range is so
Yeah.
small that
Yeah.
it is like a major, major source of toxicities. Meloxicam's another one. I mean, that
Yeah.
can be given to dogs, but again, you have to know the dose.
Mhm.
And so I think like, I mean, but I definitely use carprofen more frequently than anything else.
Mhm. No, I definitely do, and, I've seen a lot of owners, they have one pet, and they'll give that other pet that they have the medication as well, and they'll
Yeah.
kinda, like, guess on how much the dose is, and most of the time, I don't encourage it. Most time, like, there is some of these medications, like, they can get a double dose, and it's okay. Like, it's not the end of the world, so, like, if you were terribly off in your estimate of how much they should get for dog medications, it's usually not the end of the world.
Yeah. And a one
But I
off, they're going to most
exactly.
likely, if they have normal kidney function, they're going to be able to clear it. You know what I mean?
Exactly. 100%. So I think that's the big thing, but, just always you can always call. I think that's the one thing at the other time, just there's always ERs open in the middle of the night, your primary vet's open during the day, and a lot of them, I mean, you guys, I think will prescribe things over the phone if you've seen them recently. Um
If we have a relationship with them, and there's even times, because so often based on a history, like we've talked about so many times, I can hear an owner's explanation of what happened. So they jumped off the couch, or they were running in the backyard and they came in and they're limping, but they can still put weight on it. It's not swollen. When I touch it, I can't find where they're painful, but they're just persistently lame
Mhm.
for fill in the blank, like a day, 2 days, whatever it is.
Yeah.
Most of the time, I can almost guarantee you most owners are not resting their dogs, so they're not exercise restricting, they're not taking them off that foot, which of course they have to do just like we would have to do. But also, they haven't given them anything because they're afraid to give it, which okay, fair. So they call and they're like, "I don't know what to do. Should I bring them in?" And more often than not, even when they come in and I look at them, not all the time, but a lot of times I'm like, well, why don't we try rest and NSAIDs before we do, unless they have a leg hanging there that looks broken, is broken, or you know what I mean? That's a
Yeah.
totally different story. But even
Yeah.
like we talked about before with the cruciate disease, with torn cruciate ligaments, if you gave it a day, a week, even 2 weeks, it's not going to change the outcome. So you may as well rest them. And if your veterinarian's comfortable and you have a good, relationship, we know their age, we know their medical history, so we're comfortable prescribing over the phone. Yeah, I've definitely, especially on a Friday, to save them from going to see you. I have said, yeah,
Thank you.
rest them, exercise restrict them, no stairs, no running, no high impact exercise. Keep them as calm as possible. And here's an NSAID. If they're still limping by next week, drop them off. We'll sedate, X-rays, all that stuff. You know?
Yeah, I think and that actually reminds me of a good point too. Um if your dog is limping, they are therefore in pain.
Oh
And I
yes.
don't know why there's a disconnect there, but like if you're limping, there's a reason you're limping. It means you are uncomfortable. I
Yeah.
had more than enough owners who like their dog is literally limping. Like, well, I don't think he's painful. I'm like, your dog is it's literally limping. That means it's
Yeah.
painful. So
Oh yeah.
if they're limping, they're painful and they need medications of some sort
It is
or
so
rest.
true. That is such a good point. I mean, I can't tell you how many times people are like, "Well, I think they're painful," and I'm like,
So I'm like, just there.
"Would they be screaming?" Like most
Right.
dogs don't do that unless they are in excruciating pain. And even then, I've seen dogs with broken legs that will just sit there
Yep.
and maybe move a little if you touch it.
It's
No,
usually
I've
a lab.
seen
Labs are sturdy,
labs,
sturdy creatures. They're
pit
just
bulls.
pit bulls. Yeah, pit bulls too. They're like, I'm fine. You're like, no, you're not. I've seen your leg fractures. It's not good. So
Yeah,
good dogs.
your leg is hanging off. Why are you not crying? They're like, I'm happy.
Like,
Huskies, not so much.
oh yeah, you touch them with the finger, and they're like, my God, the world's
Yeah,
ended.
huskies don't even have to be in pain to scream.
My text, oh man, they give me so much. Well, I won't say. They get on me a
Fluff.
lot for it. I know, right? Almost. But they're like, as soon as one comes in, like starts screaming. As soon as you like pet it on the butt, they're like, "Why do you like this dog?" I'm like,
Yeah,
I don't know. It's just
he is an
part of
awesome
me.
dog, but
He
but
is.
he's a husky through and through.
They're the worst.
Um,
Sometimes I love them.
he is wonderful. But
Yes.
what was I going to say? So it is important though, and I cannot stress this point. Aspirin is an NSAID, but it is not a selective NSAID. So if you give it to a dog, they are more likely to have an adverse reaction. You really shouldn't be giving it at a dose that it would help their pain. You can't give it daily. Is
Yeah.
that fair to say?
I
Because
would
there
say. Yeah.
are conditions where we give aspirin for platelet issues and things like that, but it's a very low dose. And
Hmm.
even that we wouldn't mix with, I mean, unless of it we had to. I mean, there
Yeah.
are times I suppose where we absolutely have to mix it with something else. But that's not even your first choice. I mean, that I wouldn't even use aspirin unless I had to. I would use clopidogrel. So I mean, like, you know, I, I just feel like so often people are like, well, I went to the pet store and they had doggy aspirin. They should take that off the shelves. It's one of my
They,
biggest pet peeves.
I don't know why they're allowed to put that on there because so actually it's funny that you brought that up because
I
literally a
don't know.
week and a half ago I had a dog that did that. They thought their dog was in pain because they thought so they saw bruising on their dog's abdomen, so they thought they got hurt and they thought they were in pain. So they
Oh
gave it a bunch of
no.
aspirin. The dog unfortunately had a platelet disorder where its immune system was attacking its platelets and had like no platelets, so we needed to throw it on steroids. And we had no choice. And the dog had a GI ulcer 3 or 4 days later.
Oh
So
yeah.
it was like it
Although
was
maybe that dog was also just gonna have a GI bleed, possibly.
so it was this we actually ultrasounded it and they actually had a GI because we like they did
Oh,
an ultrasound
okay.
afterwards and actually because there was a lot of pain afterwards for some reason we're like this is weird why are you so much pain
Yeah.
and it was vomiting too and we're like that's weird um and yeah so I had like a GI ulcer on top of that so it's just like it was just an avoidable complication
Yeah.
so
And also too, if I think if you had called like if they had called like any veterinarian and said, my dog has bruising on its belly, should I give some aspirin? They would have been like, do not do that.
no exactly
Because the first thing
and
we would do is check their platelets
yes it's like
if
this
they
is
have
not good
bruising
like
on them.
it's like a little white Maltese too so like of course like it's just their bread and butter is to get that disease so it's
Yeah.
just
Right.
so yeah
The disease we talked about in a previous podcast. Check it
yeah,
out.
it's great information. But yeah, don't just call. Makes everything
No,
easier.
I even had a dog the other day that like had like known like trauma, but I still was like, I don't know if
You think
this is
about
the
it.
right amount of bruising. So I checked, and it was fine. But I mean, I wasn't gonna trust it. I was like, oh no, we need to know because
Yeah.
you know. So anyway, that's my PSA about aspirin. Just don't give it
Yep.
ever unless your veterinarian tells you to do it because they know a different reason or they know better in the situation. But we
Yep.
have far better drugs that you can give at much more therapeutic doses
Hmm.
safely for long periods of time. And then
Yep.
a lot of times your doctors will say, hey, let's check some blood work. Let's make sure that kidneys look good. And in
Mhm.
odd cases, the liver can be affected. And so we should make sure that that's not an issue.
Yeah. I totally agree. Is there? I guess we spent some time on NSAIDs, but there's other drugs we can use too.
Yeah, I
Is
was
there
going to
other
say we
ones?
probably should touch on some other of the drugs that we
Yeah.
use.
It's like that's so
What's
those
your
other ones. We can go
second
into different.
favorite?
Yeah. Right. I mean, gabapentin for cats probably is
Just
a close
cats?
one.
I've been
Uh,
using gabapentin for everybody.
I mean, I use it for dogs too, but I really like it for cats. But yeah, I use it for pretty much. That's the only drug honestly. It's that and gabapentin, the only drugs I really use nowadays for
Do you
pain
guys have
control.
Onsior for cats or no?
We do, and I use it occasionally. But definitely, Onsior is like the feline version of an anti-inflammatory.
It's like the only on label. Everything else
Yeah,
is off label for cats.
yeah, and so I think gabapentin. That's another drug class all by itself. So, but yeah, I like gabapentin. It's a good medic. What about you?
I mean, I use gabapentin every day.
Hmm.
It's generally not my first choice. I don't think that it's as analgesic as the carprofen is, but I think it's a really good adjunct. And I think it also depends on what you're using it for. So a lot of those kiddos, I think we talked when we were talking about back issues, like that's my
Yeah.
second. I have the anti-inflammatory, then I have the gabapentin.
Hmm.
A lot of my surgical cases, I prefer to send home not just an NSAID. They also have a long-acting opioid on board, and then I also send home gabapentin, depending on
Nice.
the surgery, right? So, I mean,
Yeah.
we can certainly talk about the injectables that we use in the hospital, but we can't take
Yeah.
those home. And so I do like there's so many different drugs that we have to use, right? And so
Yeah.
I would say probably a lot of your acute pain, you've got to be giving like true opioids, right? Like you're giving
Yeah, and I
drugs
think
med.
that's yeah. A lot of times we'll give injections of like opioids, so like hydromorphone, methadone, or buprenorphine. Those are kind of like our big
Yeah.
three, or if they're staying in hospital, fentanyl.
Mhm.
But I think it's a good point to bring up though, because like there are differences in the quality of pain medications we can send home for pain
Oh yeah.
control versus what we can give injectably. And I feel bad because like sometimes outpatient pain control just isn't enough. Like
Which is why I
gabapentin.
use such multimodal pain control.
Exactly, and I think and that's a really good point, like, using multiple drugs sometimes is helpful because 'cause you're hitting different receptors that where you get the pain response from, which is really important. So, but even sometimes, like, I think I've used stuff I like fentanyl patches actually, from time to time. Have you used it like, you use those frequently?
So the only time I used fentanyl patches was back when I was a tech, and
Mm,
that's just because the doctor that I worked with at the time was much more comfortable using them.
gotcha.
Um, I would say the owner of my clinic that would isn't like he just would never want the risk of them falling off.
Yeah,
Especially because we have so many dogs that have families and kids and other animals and stuff like that.
makes sense.
And then with the like opioid crisis, everything is so much more tightly controlled.
Mhm.
Um, so I'll be honest with you, I really don't use them very much. Why do you
Mm.
guys use the patches and not the sub-Q injection? Isn't there like an injection that's 3 days?
For fentanyl?
I thought so. Isn't there like a fentanyl one too?
So if there is, I'm unaware of it. Doesn't mean I know. It's just, because I know fentanyl usually has, like, a very short the reason I like it is because it has a short
It's very short
half-life.
acting. Yeah. Hmm.
Yeah, it's like 30 minutes. So, I don't know of an injectable version,
I thought that they
besides, like
came out with it at one point in time, and I don't know. The safety profile of it did not look
oh, really?
great to me.
Oh,
So,
interesting, okay.
but that was before we were veterinarians. So I almost wonder if it got pulled just because people weren't comfortable with it.
Oh, that might be it 'cause, yeah, I mean, I you knew a lot more before we got to vet school than I did. I was questionable at best. The fact they let me into vet school was a joke, and
That's
here we
not
are
true.
today.
I just happened to be a tech before, and so all I did, I mean, I anesthetized things all the time, like not my protocol, but I mean, I
Yeah,
saw it through, you know,
that'd be
and I filled a lot of the drugs, so I just knew a lot of the drug names. You know what I mean?
mhm,
And also too, I think a lot of things with pain management have changed. I mean, I remember before we went to vet school, everything got tramadol, 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 tramadol. And it
yep,
was this like the idea that it was like just as effective in dogs as it is in humans. And it turns out it is not.
yep.
Um, and so not to say that I don't think there's no place for tramadol. Like I'm not so like I hardly ever prescribe it. So I'll just put that out there.
I haven't given it in years. I can't remember the
Yeah,
last
I
time I
mean,
gave it.
it is most of the time when I'm prescribing it, it's because I'm refilling it for
Yeah,
somebody else. Almost always. The other times is if the dog is already on, let's say, gabapentin and they need something else.
mhm,
And the people are like not ready to go to referral, which is what they should be doing if they can't control their pain with what I'm already doing. But
yeah,
sometimes they're like, okay, we can have tramadol because you can. They work all entirely differently. Tramadol is like a opioidish kind of medicine. And then gabapentin, is basically like a nerve pain medicine, so it works
Yeah.
entirely different. And then, carprofen is an anti-inflammatory, or pred, depending on what we're talking about, anti-inflammatory pain medicine. So it's like you have literally multimodal kind of coming at things from different ways. And the reason why that's important, and I think something else that owners don't understand, they think like, well, why are we giving so many drugs? And it's like, so that we don't have to give too much of any one drug. Like
Yeah.
we're taking advantage of, like, I don't have to dope them out so much with this. And with tramadol, I feel like all they ever do is just get sleepy. I don't think it really does
Mhm.
anything for the pain. And I know they've proven that. I mean, there's studies that show that. So
Yeah. I think, and I think that to relate to that, they also do that in anesthetic protocols. Like the reason we use less, like
yeah.
we do this exact same thing. We put your pets under anesthesia. We give them several smaller dosages of different medications. That way we don't have to see the side effects of any one medication so much, because it helps kind of get them to a nice plane of anesthesia, and the side effects afterwards are much more minimal, which is nice. So same thing goes for what you're talking about, what I think is a good thing.
Yeah, yeah. So I mean, I'm pretty hawkish on pain meds because I really I truly believe that allowing them to feel the full amount of pain, you're never going to get
Mm.
on top of it again, and that wind up is a real thing. I mean, I also I can tell you that since I was a little kid, my mother would operate on babies
Mm.
because she's
Oh,
a plastic surgeon. So
that's
maybe I
so
should
weird.
specifically say why. So she did a lot of surgery. She did a lot of like facial reconstructive surgery. And there was a time, I think it's actually not even like, there's some people who still think that that babies don't feel pain the same way that like adults do. And my mother was always like, "Oh, well then why do my babies eat after surgery?" Because she was so hawkish about their pain management. And so I think that always stuck with me, that I was like, these tiny little creatures are in our care. And
Oh yeah.
there was a time where, people didn't think animals felt pain the same way that we do. And yes, they do.
Yep.
So they're just better at hiding it.
Most of them are. Yes.
Not huskies, but I mean, like, everybody else is better at hiding it.
Chihuahuas aren't much better. All right. Those little guys are,
They're
uh,
not. No, they're definitely not.
they're just more aggressive
And
about their feelings.
and there's just some dogs that you look at and you're like, you're gonna scream when you come out of surgery. Like,
Yep.
it's nothing to do with like pain at all. It's like I just know they're just gonna be very confused and dysphoric, and they're just gonna talk to
Mm,
us for a little while.
yep. And that's what they made earplugs.
And
Kidding.
well, no, we give them things so that they can be calm and they can feel comfortable. Robert.
I'm just kidding, sort of. Every once in a while,
Julie's
like,
like, they're cruel. Why are they talking about this?
what's more like, so it's a dog. It's funny because so on the line of eating like NSAIDs in too much quantity, dogs can get very sick from those when they do that, but they don't know they're sick yet. So they come in, they're bouncing around, they're happy as can be. They don't realize they ate a very toxic dose of something because they're like, I just had 100 pills of this beef flavored treat.
And it was
My day is
good.
awesome, right? It's like everything's great. Meanwhile, their liver is like, oh, we're in trouble. So while they're being hospitalized for the first 12 hours, they are barking up a storm, even with all the sedatives I give them, because they're like, I'm just happy to be here and I'll make your friends. On my texts are like, if you don't make them quiet, I'm going to kill you. I'm like, all right. So anyway, it's yes, sedatives are nice.
Mhm. They are. They're very helpful. And I think also too, they used to think that if you would let a dog feel all the pain after surgery, that they would themselves calm themselves down, and so they would be less likely to jump around and ruin their surgery site and all sorts of stuff. And I say better living through chemistry. Not just me, but like the whole everybody. That,
Everyone.
you know, give them sedatives. I always tell people, I'm like, my goal is that your dog goes home and wants to sleep, can get up to go outside to pee and not pee on themselves, but then they want to come back in and take a nap. That's just the right amount of sedatives for
Yep.
after surgery.
I 100% agree. That's the best way to do it.
I
Oh, that's
can't tell
funny.
you how many people are like, they won't keep the e-collar on. I'm like, that's because you're not giving them enough sedatives. That's because they're
They're not
too
high enough.
aware of it.
Right? Exactly.
And it's
Make
two
them
weeks of
high.
your life. So you can just make them keep it on. It's not the end of the world.
It's so funny. People are just like, I just can't bear to have them in an e-collar for 5 days. I was like, it's 5 days of their life. Like,
You can. or
Yeah,
you're gonna have to do something way more drastic.
exactly. Trust me, like that 5 to 10 days or 14 days, it's 100% worth
It's
it.
definitely
So
worth it. And it's not to say that like the first e-collar that I had on Gus after his neuter was ridiculous. I mean, he was hitting everything. Like he couldn't walk anywhere. He was such a like ah, he was like literally the like most uncoordinated dog ever. And I was like, all right, we got to get him a better cone. So I got one of those comfy cones. Not that I'm like
oh,
specifically telling people to go out and get a comfy cone, but they're like vinyl and they're much more narrow. And
uh,
he didn't hit everything in it. He was much more comfortable with it than the big, huge plastic, so.
well, it's good to actually keep that in mind because it's really important to keep them like from licking those sides. So anyway, you can get
Oh
that
my gosh,
done.
yeah. Well, that's why I
Incredibly
tell people all
important.
the time about lick sleeves too, because like that's, I mean, there's, you don't want to put an e-collar on them, fine, but then you've got to cover their TPLO incision. You got to
Mhm.
do it.
Yep, gotta do it. So we tell
So
you
you
these things
never
for a
use
reason.
tramadol, huh? You don't send it home ever?
I haven't used I honestly haven't prescribed it in 4 years, I think, probably 4 or 5 years.
Is
Um,
gabapentin controlled in California?
no. But I do use a codeine from time to time. Codeine's not, I think codeine actually works. It's another opioid type drug, so it's similar to tramadol, but just I think it works better.
I think
A lot of
codeine's
times,
great. Yeah, I
yeah,
agree with you. I've had a harder time getting it is the problem.
get it or really interesting. Okay.
Yeah. There's
I
been
mean,
a couple of
yeah,
times where people have come up against like problems or whatever. It may have been back when hydrocodone, which technically is an opioid, but we don't really
mhm,
use it for pain, but
yeah.
we use it a lot for coughing in dogs. Um, it's been on back order for like a year. And
How's it really?
so there was a while where a lot of those people they were like, what can we use? And I was like, codeine? I mean, I guess we can try codeine and like we just I don't know. I'd have to delve back into why it is we couldn't get it. And it may have been that a lot of them had Tylenol in them, which is fine. And by the way, two things. One, Tylenol is not an NSAID, just so you
Yep.
know. That's
Good
a
enough.
big misconception. People think like Tylenol's an NSAID. They're like, you can't give that with that. I'm like, it's not. They're two different classes of drugs.
Mhm.
Number one. Number two, um, Tylenol is totally fine for dogs at the right dose, but it will kill your cat.
Yep. That's a very good point. That's that one I've seen one too often. So definitely don't do that.
Yeah, I think we talked about that actually in the toxicity podcast before, so go back and check that one out if you want. But yeah, I actually have a dog that has such severe arthritis that we have him on carprofen, gabapentin. No, I think he might be on a mantidine now, which is also another really good drug. Do you ever use a mantidine?
I've used it more recently.
Yeah,
It's newer to me though.
I like that one because I feel like it doesn't make them as loopy as the gabapentin does. That's the one complaint that I get about gabapentin is that I've had a lot of owners call me a day later or two later, even though I warned them.
Oh yeah.
They're gonna be drunk. If they're a little bit wobbly, it'll wear off. But like that's definitely the one thing where people are like, that drug made him he was really drunk. I'm like, yeah, okay. I mean, that's fine, but he shouldn't have been running around anyway. So let him
Yeah.
lay down.
That is
But
the goal of pain medications. So
yeah, but the amantadine doesn't seem to do that, and it does seem to
nice.
help quite a bit.
Oh
Uh,
nice.
yeah, for the chronic arthritis. I mean, I really only use it in arthritis, so I guess to be fair, it's like for those ones where
Mm.
what we've been doing really isn't working. Um, and then we also have him on Tylenol too at this
Okay.
point. And then I'm hoping not to bring up a whole nother class of drugs, but we should do an entire podcast on this. But they're coming out with the monoclonal antibody for osteoarthritis
Oh boy, yeah.
in dogs.
We should have a whole podcast of that alone. So I think that's
I think we really should because between Cytopoint, the cat one, and then this one, like I think this is the wave of the future. So stay tuned. We'll definitely do one on monoclonal antibodies, but
yeah.
because that's going to be how we treat disease. I mean, that's just the next step.
Yeah, and I think especially Celentia, so what's it called?
The one for
Cats.
cats, yeah,
Yeah, so
Solensi. It's already out. Yeah,
Celentia, yeah. I don't ever use it, but I actually learned about it at the conference I was at, and like people are raving about it. Like it just
we
really helps
have it.
cats.
I just haven't been able to convince a cat owner to give it.
If honestly, if I and again, I have never prescribed this medication, but the amount of people that I've heard that on their cats are on it, love it. They said
That's
like their cat
I've
is
heard
able
the
to move
same.
again. Like if you listen to Dr. Sam, if you're listening to this, listen to Dr. Sam because I've heard just incredible reviews about it. It's been pretty cool.
I think you
So,
said before on a previous podcast when we were talking about lameness in cats, um,
mm,
I think the problem is people don't recognize it as such a
yeah.
problem, and because it's a newer drug, it's not terribly cheap.
No,
It's not exorbitantly expensive either, but it is not
mm.
super cheap, and it is a monthly injection, and so I just haven't really had anyone go for it yet.
Which is crazy to me because like you got to give your cat an injection. You don't have to give them pills every day.
Hmm.
Like I know it's expensive, which I understand. So I get that. But
Yeah.
man, it is going to be yeah, it's the way of the future for that one. I think so. Pay attention.
Yeah, for cats, for dogs. I mean, I have a list already that I have every time I walk out of a room, I add a dog to my like arthritic list of like when this comes out, you're the people that I am calling to be like, all right, come on, let's do it.
Yeah,
Because everything I've heard, it's in the US, it's in Canada, and not in the US, it's in Europe and in Canada. So we're waiting here in the US for it, but it should be coming soon. So I'm
the
really,
Zoetis rep that I talked to said it's right around the corner.
does that mean like
So
next week?
maybe not that corner. Maybe the next couple corners. But
But I did actually hear an interesting thing. Some people are giving subcutaneous ketamine for almost like microdosing, like lower dose ketamine for
interesting.
um for arthritis actually. I have not done that, but
For cats or dogs or both.
dogs, for dogs.
Yeah, cool.
Yeah.
Interesting.
Which is
See,
interesting because you'd think if amantadine worked, then that it like because they're this, you know what I mean? Like it's an
yeah, same
NDMA,
drug.
and you'd think, but I don't know. Not to get too technical, but it's just an interesting thing because most people have heard of ketamine, like Special
Yeah,
K,
that's what that's everybody's like. You're taking Special K. I was like, no, I haven't taken Special K. Like, it's like,
No. Have you
it's like,
met me? No.
it's like guys, it's like, come on. It's not like they're like, oh, you're a vet though. I'm like, that doesn't mean we all take it. Like, it's like, hey, I gave it to my patient. I should at least try it to make sure it's safe first. Like, no.
No,
So
no, no. The closest I've ever come to taking any of my pets' medication would be that I did try our compounded gabapentin because I was on gabapentin for my joints, and I was like, "What does it taste like?" And I just was like,
you're like, nah, I can see why they don't like it.
well, because
So
because it is very bitter, and I knew that from like myself from knowing it. But I was like, well, what? I mean, because they chicken marshmallow flavored it. It's like, what does that taste like? It's not
wasn't it
good.
good? That wasn't good. Oh, okay, just wondering.
No,
I mean,
it's
I would
definitely not
definitely
good.
try it for like chicken marshmallow. I'm like, I wonder what this flavor is. That's not like a normal flavor. So
No, no, because all it tasted was like bitter pill sweet, meh,
mm,
salty. Like it wasn't good. But I
yeah,
but
okay,
I think I will say for our cats though, like it's nice that we have it compounded in
hmm
a flavor because they don't need very high doses. I mean, obviously for the ones coming in taking gabapentin for their behavior is a completely different story. But like when you're
yeah.
talking about chronic pain and stuff like that, and I have had a lot of cat owners that are like, I love gabapentin. Like, thank you for giving my cat gabapentin.
Yeah, I think it's a great medication. It's yeah, I think that's not going anywhere anytime soon. Thank God.
No,
So
it's every place. Anytime I'm sending out referrals now, like for orthopedic surgeons or Purdue, I mean,
yeah,
everyone's adding gabapentin to their protocol.
yeah, it's a better way to, like I said, better living through chemistry.
Yes,
So
exactly, exactly. But I think that those are I mean, for me, those are the big ones. Those are the ones that I use every day. I'll give a shout
mm.
out to like, there's, like we said in the beginning, like lots of different um non-steroidal anti-inflammatories. Have you been using Galliprant at all? What's your take on that one?
I haven't. It's I should. The cat, if a dog actually has kidney disease, I think that's the. So I'm guilty of it. Looks like I'm guilty of it. Change is hard for veterinarians.
It is very
We
hard.
get comfortable with certain medications, and now I just realized there's really no reason for me not to. I think it's just I'm less comfortable with it because I haven't used it as much.
Yeah,
Same thing with the amantadine. Actually, like just haven't used it as much. I think if I get more comfortable with it, once I see a coworker use it a little more, then I'm like, all right, yeah, no, I'll check it out. But
yeah,
yeah, it's like carprofen I just used is such a staple for me for I think it's safe and I like it and it's good.
yeah.
But
I
yeah, do
think
you
it
use it?
works better.
Really?
So I will tell you that I've had much more success with the pain management side of things with carprofen. I use a
Oh,
lot of
okay.
Galliprant because I have a lot of dogs with comorbidities.
Okay.
And I will say that there are times where we're making a judgment call where I'm like, well, you're not getting, you know what I mean? Like, are we getting to that point where they're not walking super well? They're 15. Yeah, they have some kidney changes. But at this
Sure.
point, like, you know what I mean? So we do have to make that choice. Now, I will tell you, I have a handful of patients that are on Galliprant, which just for those of you listening who are not like familiar with these drugs. So Galliprant is also a non-steroidal anti-inflammatory, so an NSAID in the same class as carprofen, but it's very, very different because it is much more specific. Like it specifically blocks one part of the pathway of pain that is blocked by carprofen. It just does it way lower down on the chain, so it specifically blocks what's called prostaglandin, which is like part of what causes pain. But there's good prostaglandins and there's bad prostaglandins, and there's things that affect the kidney if you block the good ones. And so this blocks it further down where it's not blocking the good ones, just the bad ones. Is that a good
Which is really helpful.
explanation?
Yeah, I think so. Yeah, you
I was like,
prostaglandin.
is it too nerdy, my explanation? But there is a reason why. So I have like a dog, well, multiple, but I have a couple that have kidney disease, well-established kidney disease that are pretty stable on KD and they're doing okay, but
Yeah.
really do have some um, osteoarthritis. And those dogs, the ones that are maintaining a really good body condition, so they're thin, they do
Mhm.
seem to do a lot better, which of course is would make sense.
Yeah.
But I really do have a few that just the Galliprant just didn't work for them. It wasn't a strong enough NSAID.
And that's something I always wonder about. Like, and I guess I gotta look into studies of like even the twice a day versus once a day dosing of carprofen. Like, does that make any because I think Galliprant's only once a day, right?
It's only once a day.
Yeah.
I am interchangeable with carprofen. I use a lot of once a day dosing with the carprofen for the pure fact
Oh,
that it's such
mhm.
odd dosing sizes.
Hours. Oh,
Odd
oh.
dosing sizes. Like you have certain dogs that are like 62 pounds, and I'm a nerd and don't want to give them 50, but I also don't want to give them 75. So I will be like, give them 1 1/4. I'm talking about for like years. You're talking about for 2 weeks.
That's most of the time I'm just like, you can take a dose for a bit that's a little higher. You'll be fine. So,
And for
yeah.
those cases that are like acute, I agree. But when it's arthritis, I try
Yes.
to use the lowest effective dose.
Well, you should talk to all those carprofen makers out there and be like, fix your dosing because this is awkward.
We do.
So
I think they need a 50 milligram. It would make
I
our
sh-
lives a lot easier.
I'm surprised no one's done it yet because honestly, that's the way to make yourself stand out in the crowd because everybody else makes the exact same dosing sizes. And honestly,
No. And maybe I'm just being a baby and like I'm just way much more of a worrywart, but I want to get as close to what their actual dose is.
I can just imagine you like over your computer being like, I gotta make this work. Ah.
Do you know that my techs already know? Like they're like, I have an 18-pound dog. They're like, okay, give a quarter of a 75 milligram twice a day. Like they know me so well. But I don't know. I just, I feel like I don't want to ever do any harm. And I'm probably way over worried about it.
No, no, it's a really good thing to be careful because like you never know. Like I said, when they're on it chronically for a year or two, like it might have an impact that I don't have to worry about it as much because I'm like, you get 2 weeks worth, and I'm never talking to you again. So good luck.
So do you
So
actually give out that much? Because our ER never gives more than 3 days of anything.
I'll give out more than because otherwise they're gonna call me because a lot of times they call us back then like, hey, we can't get into our vet now, and I need the medication, and their vet won't prescribe it for them because they haven't seen them in a year,
Oh,
so
yeah.
or longer, who knows? And they're like calling me for because I'm the only vet that's seen them, so now I got to prescribe more of it. So I give them the pure simplicity of making sure they get to
Your
where they need to
life.
be.
Yeah.
Well, otherwise I get a lot of angry emails from the pharmacy department, and I like them a lot, so I don't want to piss them off.
Yeah, that's probably very smart. That is a very good thing. Try not to
They're
piss
lovely
off everybody
people.
that helps you.
Yep, they are lovely people, and I try to stand on their good side. So thank you,
That's good.
Jane, if you're listening to this. Talking to you. So
Um, so our local ER gives out like 3 days worth. I mean, like Purdue and all that, they'll give out like a full course, right? But
okay,
most of the places around me are like 3 days. And then like I had a dog that's been a patient of ours forever. And I mean, I just saw this dog not that long ago, and then it had its
yeah,
first seizure.
okay,
And and it was like clustering. So they did
mhm.
like a bunch of phenobarb, like they loaded some phenobarb and then sent home 3 days worth of phenobarb.
That's not helpful.
No, it's not.
That's
And I was like, well, yes, of course I'll fill it for you. I did the math. I mean, I just saw the dog. It's fine. I would never take him off of it anyway. They had done blood work. I mean, like they did the right
yeah.
workup, but like 3 days. No, why would you ever do that? Just give him the like month that he's gonna need before we're gonna check his, I don't know. It's crazy.
No, I agree. It's like saving your coworkers time, like, and saving the owner's money because they have to pay for another exam fee, potentially, and then they're like, it's just
Well, I
one of these
literally
ones.
just saw the dog like the week before. So I
Well,
was like, I
that
will
part's
just
nice
fill
at least.
peanut butter for you.
Yes, but yeah, it's like anyway. So it's just funny.
Yeah, but I mean, but it is. I mean, I still had to go into the record, go through everything. I mean, like I had to make sure, like, so on some level,
Yeah,
it's like more work for me because I didn't have the opportunity to do my job and actually like. I mean, I know it's not all about money, but like I didn't get paid for that. I just did it because I care about the dog and I care about him,
yeah.
and you know what I mean, and whatever. But that's that's what happens.
It's a lot of extra time. So
I'll have to ask
yeah,
my friend. I have a friend that's going to start working there, and I'm going to be like, "Can you please prescribe longer? Why are you doing 3 days?
no,
What is that?
just do a little bit longer. It's okay. It makes everything
At
easier.
least
I
two
made it a
weeks,
short
like you
supply.
said. What are you
Yeah, like
doing?
10 to 14 days, man. So that way it gives them some time to follow up with the regular vet and
Unless it's an
see.
antibiotic.
Unless it's antibiotic. And then we had a wonderful conversation about that last week. So if you have not tuned in
Check it
yet,
out.
check it out. So we're gonna self promote the hell out of this
Yeah,
podcast.
right. Just the people who listen to it already. So
Exactly. All I'm not sure what they are, but thank you for being here with us on this lovely afternoon.
we do appreciate it. And if you have any questions, if your dog's having chronic pain or experiences acute pain every once in a while, well, first off, you should definitely talk to your veterinarian. But if you have questions for us, you can always email us at podcast@mybalto.com and we'd be happy to answer it. Or if you have a drug that's worked amazingly on your dog and we didn't talk about it, hey, I said we're just going to touch on a very small piece of things. There's a lot more about pain management that I think we can delve into another day, specifically monoclonal antibodies, but that's not just pain management. So we'll talk about that whole thing another day.
Yep, that sounds great. And yeah, I'm excited. We'll talk about it soon.
Soon. We
Soon.
got so many things we want to talk about. So one by one,
Mhm.
we'll get through them all. But this has been the Pause It Podcast. Thanks so much, everyone, for listening.
Thanks, guys.